Good afternoon. My name is Michelle Scoltati and I'm here to tell you about a relatively common condition that involves a group of disorders called seizures. Before I begin, I would like to tell you that I got my information from my personal experience with this disorder because my brother had it, and I also got this information from www.webmd.com. Signs and symptoms of epilepsy include absent stare. The person may seem to be staring into space, may have tremors, memory lapse, fluttering eyes, blinking, and involuntary muscle movements. Types of epilepsy include type 1, which is idiopathic generalized epilepsy. A person affected by this would have a family history of epilepsy. It may appear during childhood or adolescence, but may not be diagnosed until adulthood. The brain is structurally normal on the MRI scans with these people, and the types of seizures affecting patients with idiopathic generalized epilepsy may include myoclonic seizures, absent seizures, generalized tonic-clonic seizures. Idiopathic generalized epilepsy is also is treated with medications. Type 2 is idiopathic partial epilepsies, and this may usually begins in childhood during the ages of 5 to 8 and is considered the most mildest form of seizure, and the seizures tend to occur while a person is sleeping. Another type of epilepsy, type 3, is symptomatic generalized epilepsy. The person may incur a brain damage during birth, and another common cause is in generalized epilepsy is that they may have neurological problems such as mental retardation or cerebral palsy. And also type 4, the last type of epilepsy, is symptomatic partial epilepsy, and it is the most common type of epilepsy that begins in adulthood. It occurs frequently in children. This type is caused by localized abnormality of the brain, which is congenital or present at birth. Scarring or sclerosis of brain tissue may be present. Cysts or infections may also cause this type. And sometimes these brain abnormalities can be seen on MRI scans. This type of epilepsy may be successfully treated with surgery, and they try and remove the part of the brain that is affected without compromising the function of the rest of the brain. EEGs, or electroencephalograms, are used to diagnose epilepsy by recording the brain activity. Different brain activity occurs while having different types of epilepsy. Excuse me. Excuse me, I'm sorry. Types of epilepsy that or types of seizures, that are involved in epilepsy are generalized seizures. All areas of the brain are affected by these seizures, and sometimes they are referred to as grand mal seizures. The observer may think that the person is experiencing a seizure, and they will make a cry out sound, or for some seconds they may have rhythmic movements of the arm or the leg, and the eyes are generally open. The person may appear to be breathing, and they often are breathing deeply after an episode. The return to consciousness is gradual and should occur within a few minutes. Loss of urine is also common, and often people will be confused for like a few moments while the seizure is occurring or after the seizure has occurred. Partial or focal seizures, only part of the brain is involved in these seizures, and depending on the part of the brain that is involved, that is the area that will be affected by the seizure. So say that the area of the brain involves movement of the foot or the hand, those will move when they're inquiring a episode. And also generalized seizures and descriptions of the seizures are grand mal or generalized tonic-clonic seizures. This may cause unconsciousness in a person, convulsions, muscle rigidity. Absent seizures, there may be a brief loss of consciousness. Myoclonic seizures, they may have sporadic movements such as jerking of the arm, or clonic seizures, there might be repetitive jerking movements. Tonic seizures, the person may inquire muscle stiffness or rigidity. Atonic seizures, there may be a loss of muscle tone. I'm sorry, my throat's dry. Partial seizures include simple motor skills, sensory skills, and psychological skills that may be affected, like jerking, spasms, head turning, unusual sensation in the vision, hearing, smell, or taste, and even in the touch. Some people have emotional disturbances and memory disturbances. Complex partial seizures, the person may have lip smacking, chewing, fidgety, walking, and involuntary but coordinated movements. In partial seizures with secondary generalization, the symptoms are initially associated with a preservation of consciousness that then evolves into a loss of consciousness, and may even involve convulsions. Some known causes of epilepsy or seizures are tumors, chemical imbalance, head injuries, toxic chemicals of drug abuse, alcohol withdrawal, birth injuries, strokes. Treatments for epilepsy and seizures include carbamazepine, divalproex, diazepam, ethosumoxide, phenytoin, phenobarbital, phenylprimidone, valproic acid, and some of the newer treatments for this disorder are felbedol, gabapentin, lamotrigine, pregabalin, triagabine, topiramate, levetiracetam, and also zonisamide. So there are many treatments out there, and these people do have options. Some support organizations for people with epilepsy are www.epilepsy.foundation.org, www.epilepsy.com, www.geosites.com/epilepsy911. And that is all for tonight. I would like for you to ask any questions if you have any, and if not, thank you very much and have a good night.